Want to know you're on the best path to the right car? Start at CarMax, where every car is CarMax certified and backed by a 10-day money-back guarantee at a price that's upfront from the start. Visit CarMax.com for details. Want to drive? CarMax.
Hey listeners, this is Peter and welcome back to the History Shorts. Today's episode is brought to you by the Podcast Republic, your ultimate listening app. Discover and subscribe to thousands of podcasts from around the world. Download Podcast Republic today, available on Google Play and the Apple App Store. Today on History Shorts. On April 12th, 1955, the United States celebrated. The announcement came from the University of Michigan, and it was exactly what the country had been waiting for. Jonas Salk's polio vaccine worked. The results of the largest medical trial in American history, 1.8 million children, the so called polio pioneers who had rolled up their sleeves in 1954, were in. The vaccine was safe. The vaccine was effective. 80 to 90% perfection against a disease that had paralyzed or killed American children every summer for decades. Church bells rang. Parents wept in the streets. It was, without exaggeration, one of the greatest days in the history of American public health. 12 days later, a child in Idaho who had recently received the Salk vaccine developed paralysis. Then another, then more. They had polio, and they had gotten it from the vaccine. Our history brief today returns to History is Weird and why Romans built public toilets with no dividers. A quick word from our sponsors.
Hey, it's Ryan Reynolds here from Mint Mobile. Now, I was looking for fun ways to tell you that Mint's offer of unlimited premium wireless for $15 a month is back. So I thought it would be fun if we made $15 bills. But it turns out that's very illegal. So there goes my big idea for the commercial. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3 months, $90 for 6 months, or $180 for 12-month plan required. $15 per month equivalent. Taxes and fees extra. Initial plan term only. Greater than 50 gigabytes may slow when network is busy. See terms.
This day in history. On August 9th, 1945, the United States dropped a second atomic bomb, this time on Nagasaki, Japan. Combined with the Soviet Union's entry into the war against Japan, the attack helped bring World War II to a close, but at an enormous human cost. On August 9th, 1974, Gerald Ford was sworn in as President of the United States, following Richard Nixon's resignation. In his first address, Ford famously declared, "Our long national nightmare is over." Story of the day. To understand what went wrong, you have to understand what the Salk vaccine was and how it was supposed to have worked. Polio was, by the early 1950s, the most feared disease in America. Every summer brought outbreaks that left children in iron lungs, in wheelchairs, in graves. The 1952 epidemic was the worst in American history. Nearly 58,000 cases, more than 3,000 deaths, 21,000 cases of paralysis. Salk's breakthrough was conceptually elegant. Take the poliovirus, kill it with formaldehyde so it cannot replicate or cause disease, then inject the dead virus into a patient. The immune system recognizes the vital proteins, mounts a response, and builds immunity, protection against the live virus without ever encountering the disease. The critical ward was killed. The entire safety of the vaccine rested on the completeness of that step. If even a small number of live virus particles survived the inactivation process and made it into the dose, the patient would not be receiving protection against polio. They would be receiving polio. In the spring of 1955, the federal government moved fast. The trial results were announced on April 12th. Licen- Licenses to manufacture the vaccine were granted to 5 pharmaceutical companies within days. One of them was Cutter Laboratories, a family owned firm in Berkeley, California. Cutter was smaller and less experienced than some of the other licensed manufacturers. And in the rush to meet the enormous public demand for the vaccine, parents across America were desperately trying to get their children vaccinated before the summer polio season. Something went wrong in Cutter's manufacturing process. The formaldehyde inactivation was incomplete. Some of the virus in some of Cutter's vaccines was not quite dead. It was alive, and it was injected into children. By the time the first paralysis cases were reported and tracked back to Cutter's product, the company had already distributed approximately 380,000 doses. The vaccination program was halted. Cutter's vaccine was recalled, but the damage had been done. The numbers, stated plainly, are devastating. 220,000 of the children injected with Cutter's vaccine would suffer abortive or short lived polio. 164 were severely and permanently paralyzed. 10 were killed. And because polio is contagious, the live virus from the vaccine spread beyond the vaccinated children to their families and communities. In total, the Cutter vaccine caused 40,000 cases of polio, left 200 children with varying degrees of paralysis, and killed 10. 10 children dead, hundreds paralyzed, tens of thousands infected by a vaccine that was supposed to end polio. The horror of the specific irony. Children who had lined up to be protected from the disease that terrified their parents, injected with the very thing, is not something that statistical language can fully hold. Parents who had waited in line for the vaccine to protect their children watched their children develop the disease they had been waiting in line to prevent. The response was swift, and in several important respects, admirable. The Surgeon General, Leonard Scheel, convened an emergency meeting within days of the first paralysis reports. The public health system moved to identify, trace, and recall the contaminated lots. A scientist named Bernice Eddy, who had actually flagged concerns about the safety testing before the vaccine was distributed, and whose warnings had not been acted on with sufficient urgency, was vindicated. And the federal government faced a fundamental question. The vaccine itself was safe and effective when properly manufactured. The Salk trial had demonstrated that beyond reasonable doubt. The problem was not the science. The problem was the manufacturing standards and the oversight system. Both needed to be rebuilt from the ground up. What came out of the Cutter incident was, in the history of American public health, one of the most consequential regulatory overhauls ever undertaken. The Division of Biological Standards, the federal office responsible for vaccine oversight, was fundamentally restructured. New, more rigorous manufacturing standards were written and then enforced. Safety testing requirements were strengthened. The process by which vaccine lots were inspected and cleared before distribution was redesigned to catch exactly the kind of failure that had allowed Cutter's live virus batches to reach children. After the government improved this process and increased oversight, polio vaccinations resumed in the fall of 1955. The program continued, and the vaccine worked. By 1961, polio cases in the United States had dropped from 58,000 at the 1952 peak to fewer than 1,000. By 1979, wild poliovirus transmission in the United States was declared eradicated. The Salk vaccine, the same vaccine properly manufactured under new standards, had done what it promised. The Cutter incident occurred because the oversight system that existed in April 1955 was not adequate to catch what went wrong. The testing requirements were insufficient. The inspection process had gaps. The speed of the licensing, driven by public desperation and political pressure, to get a life saving vaccine to children before the summer polio season had outpaced the regulatory infrastructure. That is not a comfortable fact. That is true regardless of how uncomfortable it is, though. The system that should have caught the problem did not catch it, and children were paralyzed and killed. And then, this is the part that kind of matters for everything that came after. The system was not abandoned, it was fixed. The oversight apparatus built in the aftermath of the Cutter incident is the same apparatus, extended and refined across 7 decades, that governs vaccine manufacturing and safety in the US today. Every vaccine reviewed, every lot tested, every safety signal tracked. The institutional machinery that does all of that, in significant measure, built on the lessons of what went wrong in a Berkeley laboratory in the spring of 1955. In case you were wondering, Cutter Laboratories paid damages to the families of the children who were harmed. The case produced a landmark legal precedent, holding a manufacturer liable even without a proven negligence, simply for releasing a product that caused harm. Jonas Salk, who had nothing to do with Cutter's manufacturing failures, carried the weight of the disaster for years alongside the triumph that preceded it. He died in 1995. The wild polio virus is now endemic in only 2 countries on Earth. The History Brief. Imagine walking into a public restroom. Now imagine there are no stalls, no doors, no dividers, just a long stone bench with 20 holes cut into it, and 20 people sitting side by side. Welcome to the public toilets of ancient Rome. To modern eyes, it sounds like a nightmare. To the Romans, well, it was perfectly normal. In fact, some of the largest public latrines could see dozens of people at once. Archaeologists have uncovered them across the Roman world, from Britain to North Africa, and many are remarkably well preserved. So, why didn't they have any privacy? Because the Romans thought about bathrooms very differently than we do. Public latrines weren't just places to relieve yourself, they were social spaces. People actually chatted with friends, discussed business, shared gossip. Some historians even compare them to modern coffee shops, except with much worse seating arrangements. The engineering, however, was surprisingly advanced. Most Roman public toilets were connected to sophisticated sewer systems. Fresh water constantly flowed beneath the seats, carrying waste away, while another shallow channel of running water flowed along the front of the bench. Which brings us to another strange question. What did they use instead of toilet paper? Well, the answer was something called tersorium, essentially a sea sponge attached to the end of a stick. After use, it was rinsed in the running water, sometimes cleaned with vinegar or salt water, and then left for the next person. Yep, it was shared. You're welcome for that image, by the way. Anyway, despite all the engineering, Roman bathrooms weren't exactly pleasant. Sewer gases could build up, rats were common, insects were everywhere, and Roman writers occasionally joked, or worried, about snakes lurking beneath the seats. Some people were genuinely superstitious about using public toilets. The Romans even had a minor goddess associated with sewers and toilets, named Cloacina, and some people made small offerings before using public latrines, hoping to avoid bad luck, or perhaps something worse. Interestingly, not everyone used these communal facilities. Wealthy Romans often had private toilets inside their homes. But for ordinary citizens living in crowded apartment buildings, public latrines were simply part of everyday urban life. What's fascinating is how much of this reveals about Roman society. The civilization that gave us aqueducts, concrete, and some of the greatest engineering feats of the ancient world also thought nothing of conducting conversations while sitting shoulder to shoulder in a public restroom. Privacy, at least in a modern sense, just wasn't a Roman priority. I know, history's weird. Thank you so much for spending some time with me today and helping make this little show such a mighty success. If you're enjoying this show and would like to help with its production, you can always donate a few dollars at buymeacoffee.com or become a Patreon member to enjoy these episodes ad-free. Both of those links can be found on our website at www.historyshortspodcast.com. And don't forget to check out our YouTube channel where we have different videos and series that are not part of this main feed. Have a great rest of your day, and I will talk to y'all again tomorrow.
Honestly,
Honestly, no one wants to think about HIV, but there are things that everyone can do to help prevent it. Things like PrEP. PrEP stands for pre-exposure prophylaxis, and it means routinely taking prescription medicine before you're exposed to HIV to help reduce your chances of getting it. PrEP can be about 99% effective when taken as prescribed. It doesn't protect against other STIs though, so be sure to use condoms and other healthy sex practices. Ask a healthcare provider about all your prevention options, and visit findoutaboutprep.com to learn more. Sponsored by Gilead.